Hello, in this video, I'm going to talk about the hormones of calcium regulation. So there are three primary hormones that I'm going to discuss here. First is parathyroid hormone, then cholecalciferol, that's vitamin D3, and then calcitonin. So starting with the parathyroid hormone, it's a hormone secreted by the parathyroid glands in response to decrease in blood calcium. So if we look in our picture here, this is the anterior view of the thyroid gland. And if we look at the posterior side, there are these four little specks on the posterior side of the thyroid, and those are the parathyroid glands that are embedded in the thyroid gland. So when blood calcium decreases, that triggers the parathyroid glands to secrete parathyroid hormone to have the ultimate effect of increasing our blood calcium. So it does that by three different mechanisms. It signals the kidneys to increase their calcium reabsorption so that we are keeping more of the calcium that's already circulating in our blood so that we're not losing any or as much in our urine. It also signals the kidneys to increase release of vitamin D3, which I will discuss on the next slide. And it stimulates osteoclast activity in the bones. So osteoclasts are our bone cells that break down bone. So when they break down bone, they are releasing the minerals that are stored in the bone into our circulation. So if we need more calcium in our blood, more calcium in circulation for all of its many functions, one place that we'll get it is from our stored form of calcium, which is in our bones. So anything that stimulates osteoclast, CL, anything that stimulates osteoclast activity is going to increase our blood calcium. Then cholecalciferol, that's vitamin D3, that's a form of vitamin D that's formed in the skin in response to sunlight exposure, and our kidneys will also produce it in response to parathyroid hormone. So its actions are also to increase our blood calcium. It works together with parathyroid hormone. So it stimulates calcium absorption in the intestines. So our intestines can be more or less prone to absorbing calcium from the food we eat. So when we're eating a lot of calcium, it's not simply like we ate this calcium, now it goes into our blood. It depends how much of it we absorb. So vitamin D3 is going to tell our intestines to absorb more of it. So we're going to get more efficient at absorbing calcium from the food that we eat that's traveling through the intestines. It also increases the number and activity of osteoclasts, just like parathyroid hormone. So its effect, again, is to increase our blood calcium. Then finally, the last one, calcitonin, has the opposite effect. So it is secreted by the thyroid gland in response to increase in blood calcium. So as our blood calcium goes higher and higher, maybe we had a calcium-rich meal and we absorbed a lot of calcium. To make sure that our blood calcium level doesn't get too high, our thyroid gland is going to secrete calcitonin to have sort of the opposite effect. So it's going to tell the kidneys to decrease our reabsorption. So basically, it's going to tell the kidneys to excrete calcium. So we'll lose more calcium through the urine. It also stimulates osteoblast activity, BL, osteoblast activity, which is the opposite of the osteoclasts. Osteoclasts break down bone tissue, whereas osteoblasts build bone tissue and add more minerals to our bones. So essentially, if we have high blood calcium, one of the things that we do about that is our bones are going to extract more of that calcium out of the blood and put it into our stored form of calcium in the bones. So it's going to increase our bone density, essentially. It also inhibits calcium absorption in the intestines. So if we continue to eat calcium-rich foods, we will absorb less and less of that calcium because we have as much as we need in the blood. And so to keep our levels within our homeostatic range, we will absorb less of it, excrete more of it, and store what we can in our bones. All right, thanks so much for watching this video and I hope you have a great day.